Owens. He is a personal trainer with EFS, and he's going to provide a heart health presentation.
Hi guys, how's lunch? Good, all right. So like Lauren said, it is February, which is Heart Awareness Month. It's also Valentine's Day in 13 days, guys, so don't forget. Like Lauren also said, heart disease is the #1 killer in the US currently. And number 4, that goes along with it, is stroke. And every 40 seconds in the US, somebody dies currently right now from cardiovascular disease. And then every 34 seconds, somebody in the US has a heart attack. So it's a serious condition that affects many Americans. So the first thing I want to talk about is, what is your heart? All right. The first thing is, your heart is a muscle. Now, unlike the other muscles you have in your body, it's made out of what's called cardiac muscle. So you have smooth muscle, cardiac muscle, and skeletal muscle in your body. Skeletal muscle needs a stimulus from your nervous system in order for it to contract. So if you want to use your bicep, your back, your chest, a signal has to be sent from your brain to order that muscle to contract. Your heart does not need that signal. It is what's called autoarrhythmic. So it creates its own signal to beat on its own. So your body doesn't have to think about doing it. Now that heart rate can be affected by your nervous system, so stress, anything along those lines can make your heart rate go up or down, but it's its own special type of muscle. All right, and it's also the hardest working muscle in the body. And the reason for that, that I bring that up is, if you think about it, your quadriceps, your bicep, they can move for only a short period of time before you start to get fatigued. For example, if you're holding a squat, you can only hold it for so long until your body gives out, right? Well, your heart actually beats over 100,000 times a day. That equates to 2.5 billion times in your lifetime. That's a lot of work for it to be doing. It only generates about 1/20th of the power any of your other muscles can produce, but it's doing that for your entire life. So its total output of power for your lifetime is hundreds of times greater than that one muscle will ever do. It's also a pump. So it pumps the deoxygenated blood from your body to your lungs to get oxygen put back into it. That takes about 8 seconds, okay? It takes 16 seconds for it to pump the rest of that blood through your body and reach 75 trillion cells. So think about how fast and how hard your heart is working at all times, all right? So it's very important that we know our numbers. So if your heart is working that hard at all times, we want to make sure it's running efficiently and that we're not doing anything that's going to damage it. Just think of a pump on your pool or anything that you have at your house. If it's constantly working over and over again, eventually it gives out. And we don't ever want that to happen to our heart. So we always need to know our numbers. So the first number we need to know is your heart rate. How many here do you guys know how to take your pulse? All right. Sorry. The first thing I'm going to teach you guys is talk about your resting heart rate should be between 60 and 100. All right. And if you don't know how to take your pulse, it's a good idea to take it first thing when you wake up, when you are truly rested. All right. So for those of you that don't know how to take your pulse, if you've seen people in like the 1980s, Richard Simmons, What's the Oldies, they always do it up here. I don't like people when they do it up there, especially when you're exercising, because you're cutting off the blood flow actually to your brain. So you'll be on the floor next to the treadmill instead of actually standing on it. So what I recommend is, if you take your index finger and your middle finger, you're going to take it on thumb side, all right? An easy way to do it is if you actually wrap your fist or hand around and just grab, and you should be able to feel it. All right, if you have any trouble finding that right now, we'll show you afterwards. You can ask us how. So what you're going to do is, to do that, as soon as you wake up, look at a clock, look at a watch, you're going to time it for 1 minute, all right? And that'll be your resting heart rate. So we want that to be between 60 and 100, and make sure you never use your thumb, because your thumb has its own pulse, so you won't know which pulse you're actually counting, if it's the one in your wrist or your thumb. All right. The next number we want to make sure we always know is blood pressure. So we always want our blood pressure to be less than or equal to 120/80. All right. That's a pretty standard one. Cholesterol, total cholesterol is 200 milligrams per deciliter or lower. For LDLs, less than 100, and then HDLs, which is the good cholesterol, we want it above 60. If it's below 60, it's a cardiovascular risk factor. All right. And then sugar. The reason that's on there is because diabetes is a big issue with heart disease, and I'll kind of go on that a little bit later. But your HB, which stands for hemoglobin A1C, we want it less than 6. as a number if you ever see that in your blood work. And your fasting blood sugar should be anywhere between 70 to 130. So that means as soon as you wake up first thing in the morning, when they take your blood sugar, it should be around those numbers, anywhere between 70 and 130. And the last one is weight. So typically they use BMI, which is just the relationship between your height and weight, as a cardiovascular risk factor. All right? It's a good thing and a bad thing at the same time. And what I mean by that is, for example, if somebody is overweight, their BMI is going to be higher. All right? For the same thing, though, if somebody's very fit and they have a lot of lean body mass, their BMI is going to be higher. Now, the reason it's a cardiovascular risk factor is that additional weight is going to put more stress on the heart. No matter whether it's lean body mass or fat mass, it's still going to put additional stress on the heart because your heart has to work that much harder to push the blood through the system. So if somebody has all those muscles on them, their blood has to push that much harder to push the blood flow through the extra muscles that's around those vessels. So it causes your blood pressure to go up, makes the heart work a lot harder. So you see those big bodybuilders who compete in the Arnold and all that stuff every year, eventually their heart is going to have issues because of that. So there's a fine line whether or not you have too much muscle or too much fat. Both spectrums can be bad. So that's why weight is a very bad or good number to know as well. Now, heart disease is a term that's thrown around now for pretty much anything that has to do with your blood vessels, your heart, and also stroke. Okay. So here are some terms you guys might have heard before and what they actually mean. So coronary artery disease, or CAD is what it's also known as, is damage or disease to the heart's major blood vessels. All right, that could be buildup of plaque, stuff like that. It could be somehow the vessel collapsed, any kind of damage along those lines. Cardiac arrest is actually pretty much a heart attack. Your heart has stopped. They need to bring out the paddles and shock you back to life. Your breathing has stopped and you're pretty much unconscious. Peripheral artery disease is a disease of the arteries around your legs, shins, forearms. It eliminates circulation of the blood back to the heart. That's where the people have to start wearing compression socks, sleeves to help the circulation continue, so that way the blood that needs to be oxygenated is returning back to the heart and it's not pooling in those areas. High blood pressure is a very big one. So high blood pressure, it's taking a lot more force for that body to pump the blood through the vessels. All right? That could be caused by buildup of plaque. Again, excess body weight, whether or not it's the good or the bad. All those things can have conditions on the blood pressure. Arteriosclerosis, that is actually the buildup of plaque. So some people's bodies produce more plaque than others. Also, it has a lot to do with the diet that we eat. So the plaque builds up around the arteries, causing, again, blood pressure to go up. It's harder for the blood to flow through the body. Arrhythmias, so improper beating of the heart. It could be irregular, too fast, too slow. Again, these have conditions that could be affected by blood pressure, stimulants in your heart, things like that. And then heart failure. It's a chronic condition where the heart doesn't pump enough blood through the body. In general, most people's blood or ejection fraction is in like 70 percentile. So you're pumping about 70% of the blood in your heart out in each pump. With people with heart failure, they're closer down to 35%. So every time their heart feels, they're only pumping out 35% of that blood that's in their heart to the rest of the body. Congenital heart disease is an abnormality that you're actually born with. For example, I actually have one. There's a flap in your heart that closes up when you're born, that connects your heart to your mother's heart. Mine didn't seal up all the way. It really doesn't affect me right now unless I want to go scuba diving. If I want to go scuba diving, it's going to cause air bubble to go through my body and then could actually end up into my brain. So if I want to go get it fixed, then I can go scuba diving. I can snorkel, but I can't scuba dive. So anything that is affected at birth is considered a congenital heart disease. So like I said earlier, stroke is on here because heart disease, they're considering anything that has to do with vessels. So stroke is when the blood flow to the brain is interrupted, such as due to a blood clot or a head injury, stuff like that. And then finally, diabetes. And this is what I was talking about earlier. Their blood sugar is important. They now consider diabetes your first heart attack. So if you're diagnosed with diabetes, they consider that you've already had a heart attack. And once you've had a heart attack, you're more likely to have another one. So that's why diabetes is very important now, is that they're realizing there's such a good correlation between heart disease and diabetes that they're considering that your first heart attack. Now, what are some signs and symptoms I want to go over real quick? First, for your heart attack, chest discomfort. It's that elephant sitting on your chest, all right? Pain that spreads to an arm. Number 3, shortness of breath. Now, the ones that are in red, the first 3, are the ones that are considered the main symptoms, the primary symptoms people have that they know they're having a heart attack. 4 through 10 are ones that are not necessarily go-to signs that you're having a heart attack. I mean, if you have nausea and indigestion, that could be anything. All right. It's usually 4 through 10 of them. If they come along with 1 and 2, then you know you need to call 911. Number 5, feeling dizzy, lightheaded. 6, throat, jaw pain. Getting exhausted easily, fatigued. You feel even lifting, tying your shoes, you're getting tired. That is a tail sign of having a heart attack. Snoring. Now, obviously we all snore, but snoring more extremely than you normally do. So, for example, like you're choking as you're trying to breathe at night. If you're normally a snorer and you're just all of a sudden trying to catch your breath, almost like you need a CPAP machine, it could be a sign that you're having a heart attack. Sweating, and then lastly, a cough that does not quit. All right. Before I go over to stroke, though, what I want to talk about is women. They have a little bit different signs than men. All right. As they found out, the main heart attack symptoms that they've been going over for years and years and years have been mainly towards men. Sorry, ladies. For women, the signs are a little less severe. So, for example, that chest pain that you guys have, it might feel like an elephant sitting on your chest, but is not as severe as what a guy feels. So that's why a lot of women push it off. They also describe it more as a pressure in the center of their chest, or somebody is like tying a rope around their chest and just kind of squeezing them. So for women, they describe these symptoms a little bit differently. They describe it also as flu-like symptoms. Okay? So typically, if you're feeling flu-like symptoms and any of these other symptoms are around it, you're snoring more, nausea more, then you actually could be having a heart attack and we need to call 911. Also, they feel pressure in their upper back. So it might not even be in your chest, it could be in your upper back around your shoulder blades is a sign that women are having a heart attack. So if you have any of those types of symptom signs, that we want to make sure we call 911 because time is important, especially with a heart attack. Now stroke. The signs for stroke equal FAST. All right, so it stands for facial drooping. So one side of the face or the other will start to droop, lips will sag. Weakness in an arm, one side or the other. Speech, they'll start to slur their words, not make sense. And then time. Again, time is the essence. There's a drug now that if they administer in a certain amount of time when the stroke starts, their likelihood of any actual permanent damage is limited. So that's why time is of an essence. So that's why the little guy's there for CPR. All right. So risk factors for heart disease. Now there's modifiable ones and non-modifiable ones. So non-modifiable ones, age. As we age, we naturally slow down our metabolism, so our weight's going to go up. At the age of 65, we actually start to, again, develop more risk factors for coronary artery disease, anything like that. Gender is a big one, actually. So men typically have a higher risk of heart attack. The reason for that is women, you guys have estrogen, a lot more estrogen than guys. So that helps actually prevent you from building up as much plaque as guys can do. So once a woman hits post-menopause, though, their risk just gets up just as much as guys. So until the age of 55, women's risk is lower, and then once they hit the age of 55, the risk actually goes up. Genetics. So genetics can be race, ethnicity. So for example, African Americans, they tend to have higher blood pressures than Caucasians. Mexican Americans, American Indians, Native Hawaiians, and Asian Americans also have a higher risk of heart disease due to obesity and things along those lines. Family history, if a child's parents have had any kind of heart disease, they're more likely to have heart disease themselves. Also, genetic-wise, some people's bodies tend to produce more plaque than others. For example, my coworker when I worked at John Eagle, his doctor actually had to write him a prescription to get dental cleanings more often because of the amount of plaque his body built up. He actually had a heart attack. They realized his body's producing twice the amount of plaque as normal people do. So he actually had to get his teeth cleaned just as or twice as much because it was actually building up on his teeth as well. So things like that can play a role in risk factors for your heart. Previous events. So like I said earlier, once you have an event, you're more likely to have a second event. So that's something you can't control. Once you have it, you can't not have the event. Now, modifiable factors would be your habits. So smoking. Not only is smoking a powerful influence itself as a factor, but it actually adds on to the other factors as well as your weight and so on. And you don't actually have to be the smoker if you're around somebody all the time that's smoking. Being a non-smoker, it also, or secondhand smoke also adds on as a risk factor. Diet, easy one. High-fat diets, loads of sodium, all that type of stuff. The more and more processed foods we get, because in order to maintain those flavors, they have to add in the sugars, the preservatives. It's going to add on to our risk factors as well. Now, blood pressure and cholesterol, that's a huge risk factor, but it's modifiable. All right. Weight, like we talked about earlier, the more weight you have on you, again, the heart has to work harder. Physical inactivity. So sitting around, sedentary lifestyles, your body's meant to move. And if we're not doing that, again, that's going to add on to the weight. That's going to cause all these other risk factors to exacerbate. Uncontrolled diabetes. So not taking care of your blood sugars, not taking your medications. Again, that adds on to the risk factor. And then uncontrolled stress and depression, anxiety, all that stuff adds on to the amount your heart is working. So if you're stressed out, your heart's beating faster. Anxiety builds up. Depression also causes your blood pressure to raise. All right, so we want to make sure we can control the modifiable ones as much as possible. So what our idea is, we want to keep a healthy heart. And the reason for the image is hospital costs. In the US, for every $6 spent on healthcare, one of that dollar is actually for heart disease. In 2010, we spent $444 billion for diagnosis, treatment, and loss of productivity at the workplace due to heart disease and disability because of it. All right, so we want to make sure we keep a healthy heart. So we want to follow a heart-healthy diet. So we want to avoid as much processed foods as we can, actual real foods, low sodium, cook with olive oil and not necessarily canola oil or vegetable oil. So healthier oils. We want to control our blood pressure. So if you have high blood pressure and it's diagnosed, make sure you're taking those medications. Make sure you monitoring that blood pressure. If you actually lower your blood pressure 12 points over 4 years, you decrease your risk factors by like 20%. Same thing with cholesterol. If you can lower your cholesterol over so many years, you're decreasing your risk factor by 30%. So it's important to make sure we're controlling those items. So cholesterol would be taking your medications again, exercising. We want to maintain a healthy weight, and that goes both ways again. If we're a bodybuilder, we gotta know our body can only handle that for so long before we have to start cutting down our weight back to normal weight. And same thing, if we're overweight and obesity, we want to make sure we're back down to a healthy weight, whatever our weight or our body type can handle. Control diabetes, take the insulin, make sure we're exercising again, make sure we're eating the correct foods, pairing a protein with a carb so our body can actually utilize that sugar instead of it just being in the bloodstream. Manage your stress. That goes as far as praying, meditating, talking to somebody, hitting a punching bag, whatever it is, but make sure you're managing that stress so that it's not building up. Quitting your smoking, quitting those bad habits, all right? Like they say, moderation is the key, so quitting smoking obviously is the best way to do it, but for the previous slide, like they said, alcohol consumption, moderate alcohol consumption. They say a glass of red wine helps the heart, not the whole bottles. So make sure we're using a normal size glass. We've all seen the memes where like the glass is the same size as the bottle. So regular glass, not the bottle. All right. And then we want to make sure we're staying physically active. Like I said, our bodies are meant to move. So stay physically active, and we'll go a little bit more into that here in a second. So according to the American Heart Association, here are their recommendations for staying active. 30 minutes of moderate intensity exercise, okay, 5 days a week, all right? So that's 150 minutes total for the week, 2.5 hours, or at least 25 minutes of vigorous aerobics, 3 days a week, for a total of 75 minutes for the week. And then they also want you to incorporate moderate to high intensity strength training, okay? Strength training has a lot of benefits that a lot of people don't realize. So by strength training, you're increasing your lean body mass. Lean body mass is going to burn more calories sitting around, which increases your metabolism. We all know what that word is. We all want higher metabolism. We all hated that kid in elementary school that couldn't put on any weight because he had a high metabolism. So strength training is also a beneficial part. So that's 2 days a week for that. And then to lower your blood pressure, on average, 40 minutes of moderate to vigorous intensity aerobic activity, 3 to 4 days a week can help lower your blood pressure and your cholesterol. All right. Now, I'm not saying you need to go run a marathon or anything like that, but starting simple. The easiest way to start is to walk. All right. So instead of, for example, just walking to talk to somebody instead of calling them on the phone. I mean, my nephew or cousin, sits there and texts his mom from the other room when he needs something instead of just walking to talk. I know that's an extreme, but that's something simple. Walking. Start at your own pace. Everybody starts at a different pace. So the person to your left, the person to your right, you all are going to start in a different area. All right? So make sure you're starting at a pace that's comfortable for you because we don't want to overdo it. Another benefit would be to divide up your time. So they recommend 30 minutes. You could do that as 2 15-minute intervals. So 15 minutes in the morning, 15 minutes at night. You're still getting that cardiovascular benefit. Or 3 10-minute intervals. So if you can walk 10 minutes in the morning, walk 10 minutes in lunch, walk 10 minutes in the evening, it's still going to give you that same benefit. All right? Take the stairs. So instead of taking the elevator, take the stairs. So if you're parking in the parking garage and you only have to go 2 floors, take the stairs up. If you have to on the roof, that's up to you. But take the stairs. So along those lines, though, it's just not stairs, though. It's if you're at the airport and they have those motorized tracks, go to the right of it and don't take the motorized track. Or you can be like the lady I saw on the internet who was walking the wrong direction on it and didn't realize it. So she wasn't going anywhere. So those simple things that people don't realize is just something extra outside of the day that you normally wouldn't do. For example, if you're putting groceries away, do a squat when you're putting the cans of soup in the cupboard. If it's a commercial break on a TV show, my roommate and I used to do this in college. We'd have, during football games, we'd do push-ups or crunches during the commercial breaks because we didn't have time to go to the gym that day and we want to watch the Browns lose. But those types of things, it's things that you can throw in the middle of the day that are going to be beneficial for you. Cardiac rehab. I threw this on here because if you've had an event, cardiac rehab could be very beneficial for you. A lot of people think of it as something that's optional. I used to do cardiac rehab, so did Jose, and we saw a lot of our patients did better because of it. Your survival rate for not having a second one increases. So what they do in cardiac rehab is they teach you how to exercise properly. That's the first thing they do. So it helps you start at your own pace, so you're not competing at the gym with somebody who's 100% healthy and you just had an event. The next thing they do is they educate you on nutrition. They have a nutritionist usually come talk to you, educate you on what you should be eating versus what you are eating. Kind of helps you give you some dietary guidelines. And third, they educate you in general about the medications you're on, what actually just happened to you, and so on. So it's very beneficial if you learn all that stuff before you go back to your normal life, so that way your chances of survival are better. All right. Things to consider, though, while you're exercising. If you have a heart condition or in general, you want to avoid exercising in extreme conditions. So that's exercising in August in the middle of the day when it's 95 degrees out and very humid. Your body's not going to be able to cool itself. So your body is going to have to work so much harder than it needs to be. So again, that making the heart. Same thing with the cold. Your body has to warm itself. So your body's actually going to pull blood from your extremities to your vital organs if you're really that cold. So again, your heart's going to have to work that much harder to get to your extremities. Staying hydrated. This can be a reason a lot of people get sick when they exercise because their blood pressure drops. One reason your blood pressure drops is because your blood has no volume in it because you're dehydrated. So the sign is if you're thirsty, it's too late. So if you're exercising, make sure you're drinking water. Even throughout the day, you should be trying to drink 8 of these. No, how big are these? 4 of these, sorry. 8 8-ounce glasses, sorry. Avoid extreme hot or cold after the workout as well. So if you're done working out, you want to make sure you kind of have a cool down, or that's why a cool down is very important every workout. A cool down or a rest period. It allows your heart rate to come back down, your blood pressure to come back down, so that way when you go take a shower, your body's not, again, trying to fight the extreme difference of what you're at. Again, same thing with sauna. Your body has to fight the heat in the sauna and adjust again. So you let your body cool back down, then you can go in the sauna. That's why the saunas have those time limits on them too, guys. They say 10 minutes, no more than a half hour. A lot of people don't follow those rules. When I worked at the gym, a lot of people would put wet towels over the sauna thing too, so it would try to make it hotter. It's a fire hazard, but not healthy either. We also want to make sure we understand our medications. All right, and there's 2 medications I like to talk about. So if you have any questions about your medications, obviously see your doctor. But the one is called the beta blocker. It's a heart pill. It helps with your blood pressure. The way it helps with your blood pressure is it controls your heart rate. It keeps your heart rate down. All right. Now the reason that's significant is when you're exercising, your heart rate's not going to go up. All right, it's only going to go up to a certain point. Now, if you're trying to follow those cardio zones that are on the treadmill, the elliptical, your heart rate will never get up to it. So you need to find another way, which is we're going to talk about here in a second, a way to judge your intensity. All right. I had a nurse almost pass out on me 2 times after I explained it to her that she's on a beta blocker and her heart rate will not go up. She's sitting there trying to get her heart rate to 144. It was only going to 110. And she sat there, kept increasing the intensity, and then she almost passed out because her body couldn't handle it. So that's why it's important to understand those medications. The second medication is anything that you are on for diabetes. So make sure you know your symptoms for low blood pressure. Or not low blood pressure, low blood sugar, sorry. Because while you exercise, your blood sugar is going to drop because your body is utilizing that sugar. And when I did cardiac rehab, we'd have people who would be at a normal blood sugar because of their medication. They would drop 20 points and feel dizzy and lightheaded, their symptoms. We'd have people at the totally opposite. They'd be running at 300. Anything above 300, we weren't allowed to let them exercise. So they'd be running around 300. They would drop down to 295 and feel the same exact symptoms as somebody who dropped 20 to 30 points because their body's used to running at such a high blood sugar that when they even drop that small 5 little points, it makes their body feel like they've dropped 20 to 30 like an average person. So it's important to understand what your medications are. So a lot of diabetics need to eat something before the exercise. So eat some peanut butter with an apple, get the protein and the sugar so your body can utilize it to make sure your blood sugar doesn't drop. All right? So ask your doctor about the medications if you're on any of things like that, but it's important to understand what those medications will do to you when you exercise. And then lastly, know how to judge your intensity. So sweat is not a good indicator of how hard you're working, guys. Sorry, I'm sweating standing here talking to you guys. It's probably why my bald head is glowing right now. But a good way to do intensity is those heart rates. So if you're not on any medications that hinder your heart rate, a good indication of your intensity is those heart rate monitors on the machines. You calculate your target heart rate, you use 220 minus your age, real simple, easy, and then you multiply it by the percentage you want. It's usually 65 to 85%, okay? And that's the easiest way to calculate where your target heart rate should be. So those ones that are on the machine are pretty easy. They're pretty explanatory. So a good way to judge your intensity would be what's called a talk test. So if I'm on the treadmill next to Jose, I should be able to have a short conversation with him. I should not be able to give him this presentation. I should be able to answer a sentence or two kind of question, and that's about it. That's a good intensity to be working out at. Another way to be doing it is, with this little, it didn't change. There it goes. It's called an RPE, rating of perceived exertion. So they've updated this in the last couple of years. So if you guys have ever done a stress test, you've seen this. And the old stress test, it used to be ranked 6 to 20 because it was based off your heart rate. It actually correlates to your heart rate. So the top one here would be, the bottom one would be a 6. So your resting heart rate should be about 60 beats per minute. So that's the reason those numbers were like that. Now they've updated to a 1 to 10. So at 1, you're kind of just watching TV, sitting around, okay? 2, whatever that says, and so on. And then you're dead at number 10, all right? So your goal would be to be around like the 5 to 6 range, okay? So if somebody shows you this chart, you should be at the smiley face 5 or 6, you know? So that's a good way also to judge your intensity.